Hello, Mrs. Williams. Here's a short video for you to watch that will provide you with information about Coumadin, a medication that you were prescribed to treat deep vein thrombosis that you attained during your stay at the hospital. In this video, you will find out what Coumadin is used for, how diet can affect this medication, including which foods you should eat and which foods you should avoid, and some information that is important to report to your physician at your follow-up appointments at the Coumadin Clinic, which is in the Aztec Community Medical Center at 5500 Campanile Drive.
Coumadin is a medication that increases the time blood takes to form a clot. It is most frequently used in the prevention and treatment of blood clot formation in deep veins, which can also be called venous thrombosis. It can also prevent and treat blood clots that become dislodged and end up in the lungs, which is also known as pulmonary embolism, and blood clots that form from an irregular heartbeat or atrial fibrillation. Coumadin can also be used in the management of heart attacks, decreasing the risk of death, having another heart attack, or future blood clot formation.
When it comes to the effects of your diet on Coumadin, there are a few things that you should be aware of. To start, certain drinks such as alcohol and cranberry juice should be avoided, as they may increase the effects of Coumadin, leading you to bleed more than you should. In addition to causing bleeding issues, excessive alcohol consumption will affect your liver's ability to rid your body of the drug. A major food group that you should be aware of and limit your consumption of are foods that are high in vitamin K. Vitamin K actually helps the formation of blood clots, so consuming lots of vitamin K will lessen the effects of Coumadin, which is used to thin the blood. With this in mind, some foods that you should limit are leafy greens such as kale, spinach, Brussels sprouts, collard greens, mustard greens, chard, broccoli and asparagus, as well as green tea. Keep in mind that consuming small amounts of vitamin K will not be detrimental to you. However, you should be aware of these foods so that you can limit your intake wherever possible. Aside from foods high in vitamin K, other foods that you should avoid while taking Coumadin are an extensive list of herbs such as garlic, ginger, anise, arnica, chamomile, clove, donkey, fenugreek, feverfew, ginkgo, panax ginseng, and licorice root. These herbs may increase your risk for bleeding. Now that you're aware of the foods and drinks that you should limit, it is important that you keep your diet in mind for the duration of taking Coumadin.
There are some key things that you should notify your provider about when going to follow-up appointments at the Coumadin Clinic. The most important risk factor to look out for is severe bleeding. This is because the medication slows the time for proficient clotting and allows for uncontrollable bleeding both inside and outside the body. Internal bleeding can be presented in several manners, so notify your provider immediately if you have red or brown urine, black or bloody stool, a severe headache, dizziness or weakness, stomach pain, and if you're vomiting blood or vomiting substances that look like coffee grounds. Also notify your provider if you are coughing up blood, experience bruising or black and blue skin without an injury, and if you experience a serious fall or head injury. It's also important to notify the provider if you have any gum bleeding after brushing your teeth, have any swelling or pain at the injection site, experiencing a fever, taking a new medication prescribed from another doctor because of the possible negative drug interactions, or have a planned surgery. Coumadin can also cause the death of skin tissue known as necrosis. This looks like dark red or black areas on the skin. Necrosis from Coumadin is rare, but can occur a couple days after starting treatment, and usually affects patients with an inherited clotting disorder known as protein C deficiency. Please let your provider know if you see any sores, changes in the skin color or temperature which can indicate infection, or severe pain on the skin.
If you have any questions or concerns regarding your Coumadin prescription, please contact us at the Aztec Community Medical Center at 5500 Campanile Drive at 111-222-3333. Although it is unlikely, you could experience some side effects of the drug. Common side effects are nausea and vomiting, but please continue the medication even if these side effects occur. If you have any life-threatening adverse effects, please call 911 immediately. Thank you for watching.